if the rough and tumble of Chicago politics is not where you would expect to find a slightly built Catholic nun, well, you've never met Sister Sheila Line. Sister Sheila has been an icon in Chicago healthcare for almost a half a century. For 10 years in the 1990s, she made history as Chicago's public health commissioner. For 15 years before that, her work as Chicago's top public health officer, and for another dozen years afterwards, this smart, visionary, courageous woman served as president and CEO of Mercy Hospital and Medical Center, a legendary institution that has helped countless numbers of poor families on the south side of Chicago dating back to before the Civil War. As public health commissioner, Sister Sheila was never afraid to tackle the powerful. Her decisions were based on her conscience and an iron will. She was once arrested for ignoring a judge's order. He ordered her to test every child in a Chicago public school for lead poisoning because she believed the edict was unnecessarily broad. Sister Sheila said she would ignore the order because she thought it would hurt the children and deplete her department's limited resources to help the poor. They put her in jail. She was in jail for 2 hours before she was released. The first time she took over as president of Mercy Hospital in 1976, that hospital was bleeding money and on the verge of closing. Sister Sheila, with her business savvy and innovative management ideas, helped put the hospital in the black. In the year 2000, following a series of management blunders, Mercy was losing $40 million a year and once again about to go down for the count. Sister Sheila stepped down as Chicago's public health commissioner, returned to Mercy Hospital as president and CEO, and created a dramatic, historic turnaround effort at that hospital. Once again, she succeeded with a series of shrewd business decisions, innovative reforms, and determination. A year ago, Sister Sheila helped engineer the sale of Mercy Hospital to Trinity Health, the 10th largest health system in the nation and the 4th largest Catholic health system. Last week, at the age of, as she says, 76 and a half, and she insists on including the half, Sister Sheila announced she'll step down as president and CEO of Mercy Hospital as soon as her successor can be named. While she remained with Mercy as a senior advisor to the foundation, the hospital's philanthropic arm, her departure as Mercy's president and CEO brings to a close one of the most remarkable careers in Chicago healthcare in our lifetimes. Sheila Line was born and raised on the south side of Chicago, one of 3 children of Irish immigrants who met in America. She attended Little Flower Elementary School and Mercy High School. She joined the Sisters of Mercy, a Catholic religious order, in 1953. She earned her master's degree in psychiatric nursing from St. Xavier College and an MBA from the University of Chicago, and served 3 years as an assistant professor at the University of Iowa before joining Mercy Hospital in 1970. In 1976, she became Mercy Hospital's president and CEO. In 1991, Mayor Richard M. Daley appointed her city health commissioner, the first woman and the first non-physician ever to hold the job. The department's responsibilities ran the gamut, from inspecting restaurants to monitoring and controlling epidemics and protecting the public against the spread of infectious disease. Its clinics received 1 million patient visits a year and basically served as a family doctor to more Chicagoans than any other entity. HIV and AIDS were taking a devastating toll on the city and the nation. Gay and lesbian groups protested Sister Sheila's appointment strongly, fearing she would allow Catholic Church policies to dictate public health decisions. Sister Sheila surprised her critics by taking on the cause of fighting AIDS, increasing care and prevention funding from $4 million to $40 million, and promoting aggressive, even controversial prevention efforts. She gained national acclaim for her innovative programs to improve the health of poor women and children. When she learned the department had no way to know which areas of the city faced particular problems, she set up an epidemiology department. Data from the department helped her to focus and improve its efforts. She visited schools, pregnancy crisis centers, welfare clinics, homeless shelters, senior centers all over Chicago. She listened to people in order to better understand their lives, always looking for a better way to combat the city's health challenges. When she started, the infant mortality rate in some poor Chicago neighborhoods was lower than in many developing nations. She recruited 2 women in the Robert Taylor Homes, a large public housing complex, asking them to find pregnant women and escort them to one of the department's 8 freestanding clinics for care. During her tenure, Sister Line reduced the city's infant mortality rate by 39%. She sent a van to circulate through Chicago's poor neighborhoods, giving immunizations to children and dramatically increasing the percentage of kids who were up to date on their shots. She created a citywide plan that was even hailed by the Center for Disease Control as a national model to combat what she called the insidious public health epidemic of domestic violence. She created special programs to reach minority and immigrant families and established an Office of Lesbian and Gay Health, only the second such office in the nation. Sister Line received many honors, including the Excellence in Public Service Award from a blue ribbon panel of Chicago's business and industry leaders. Dr. Joanne Smith is president and CEO of the Rehab Institute of Chicago. Recently, she praised Sister Sheila and said, "She was one of those leaders who, when she gets behind something, is a train that's difficult to stop." 3 years ago, Sister Line helped prod the Illinois General Assembly to pass a groundbreaking new law, capping how much hospitals can charge uninsured patients so that instead of being the only people who are billed the full sticker price, their bills were closer to what other patients paid. She comes to the office 7 days a week, usually by 7 a.m., half walks and half jogs about 3 miles a day. Some days she trades the walk for the elliptical or the Stairmaster. 76 and a half years old. She speaks of Mercy Hospital as a mission and believes that health care is a public good. She is, in her own words, quote, "so grateful and so privileged that I've been able to be part of making things better," end of quote. But she's troubled and frustrated by all the unmet needs. When asked what changes she's seen in health care in the last half-century, she replies very simply, "not enough." Who doesn't deserve health care, she asks pointedly. In closing, I want to read a short excerpt from the Chicago Sun-Times editorial. Here's what they said about Sister Line. "Some people fight for the poor and the dispossessed by marching on the castle, torches high. Others, fighting the same fight, cross the drawbridge and work from the inside, maneuvering the levers of power, mastering the arts of management and politics. Sister Sheila Line is the second kind of activist, remarkably so, having done much to make Chicago a more caring city for half a century." The editorial went on to say, "Sister Sheila says it's time she calls it quits, but we suspect we'll see her again. She's of a generation of Catholic sisters and of a particularly steely order, the Sisters of Mercy, who tend to work until they can't work anymore. They are smart, educated women who run things. They are tough and ramrod straight, and we would rather they never retire, certainly not this one," end of quote. Well, anyone, anywhere, who questions the Catholicity, the Christianity of American Catholic nuns needs to meet Sister Sheila, a woman who has given her life to the least of our brethren. Loretta and I and countless Chicagoans over 3 generations feel exactly the same way. Sister Sheila Line's passionate devotion to health care and justice has made Chicago a healthier, better city, and we are all in her debt. Mr. President, I yield the floor and suggest the absence of quorum.
Clerk will call the roll.